Welcome to the New Dermatology Group and Health Management Partners Corporate Compliance 2019. This program provides an overview of our corporate compliance program. Upon completion of this course, you will understand the following: the basic principles of corporate compliance, New Dermatology Group and Health Management Partners' commitment to compliance, your obligations regarding compliance, the methods used to report a compliance-related event, and a review of New Dermatology Group and Health Management Partners' standards of conduct. What is corporate compliance? Corporate compliance is a program designed to prevent any accidental and intentional violations of the law, detect violations if they do occur, and correct any future non-compliance. Corporate compliance is accomplished through the following: the establishment of policies and procedures, the appropriate oversight of a compliance officer and compliance committee, training and education of all staff, monitoring and auditing of health system activity, a system of reporting and investigating potential violations, procedures for correcting violations, and a program to respond to and prevent future violations. The New Dermatology Group and Health Management Partners' commitment to corporate compliance. The New Dermatology Group and Health Management Partners are committed to honesty and integrity in all areas of our business, including, but not limited to, New Dermatology Group Health Management Partners' operations, work with our partner organizations, interactions with payers, business transactions with vendors, and the way that we care for patients. All employees are expected to comply with all federal and state laws and regulations when performing services on behalf of the New Dermatology Group and Health Management Partners. These commitments are important in building a trusted relationship with our patients. This course will teach you how to do your part to support the compliance program and how to report suspected violations. What are your obligations as an employee of the New Dermatology Group and Health Management Partners? To understand the elements of the corporate compliance program through participation in training, let honesty, fairness, respect, and responsibility be your guide. Accept only ordinary business courtesies or de minimis gifts, and to notify the corporate compliance officer or your supervisor if you suspect any violation of the law or a New Dermatology Group Health Management Partners compliance policy. What are the obligations of a provider or leader of New Dermatology Group and Health Management Partners? To build and maintain a culture of compliance, to thoroughly understand laws and regulations that affect our business, to prevent, detect, and respond to compliance problems, to prevent retaliation or reprisals against employees who report violations, and to properly document services and submit claims only when appropriate documentation supports the claim. Any person that knowingly causes a claim to be submitted that has false or fraudulent information can face civil or criminal liability. The False Claims Act liability typically arises out of a pattern of erroneous billing practices, including the following: upcoding, claims for services not provided, claims that lack medical necessity, and claims for services that are not appropriately documented. How to report a compliance concern. To report fraud, waste, and abuse concerns for the New Dermatology Group and Health Management Partners, contact your supervisor or the New Dermatology Group and Health Management Partners compliance specialist, either by phone at 920-391-5156 or via email at awarpinski@newdermgroup.com. You can request to remain anonymous when reporting a compliance concern. Include as many details as possible when reporting to facilitate the investigation, and no employee will be punished or retaliated against for making a truthful report. What should be reported? violations of laws, policies, or regulations when performing services on behalf of the New Dermatology Group and health management partners, billing errors or mistakes that result in overpayments or underpayments, any theft or abuse of New Dermatology Group or health management partners' property. In order to reduce the possibility of errors, we have adopted corporate compliance policies and a guide to corporate compliance, which includes our standards of conduct to guide our behavior. The following slides briefly describe the New Dermatology Group and health management partners' standards of conduct. Employment procedures. All employees, as a condition of their employment, are required to adhere to the corporate compliance program. In addition, employees will be subject to a criminal background check and must not be excluded or otherwise sanctioned from participating in any federal health program. Attendance at and participation in compliance training is a condition of continued employment. All employees are required to acknowledge in writing their acceptance and understanding of the corporate compliance program. Failure to adhere to the compliance policy and standards of conduct, violations of any applicable laws, rules, and regulations, and failure to report misconduct are considered to be violations of the New Dermatology Group Health Management Partners policy and may be grounds for disciplinary action, including termination of employment when warranted. Conflict of interest. A conflict of interest is defined as any action or activity of a New Dermatology Group Health Management Partners member that involves obtaining an improper gain or advantage, or having an adverse effect on New Dermatology Group Health Management Partner interests. Members must ensure that potential conflicts are brought to the attention of an appropriate individual, such as their manager and the New Dermatology Group Health Management Partners legal and compliance departments. Covered individuals and entities should always avoid any appearance of impropriety and must not engage in activity that may conflict with New Dermatology Group or health management partners' interests. If a potential or actual conflict arises, your supervisor or the corporate compliance officer of the New Dermatology Group and health management partners must be notified immediately. Procedure for reporting possible violations of law or standards of conduct. If at any time you suspect a violation of the law or any standard of conduct by an employee, medical staff appointee, vendor, or independent contractor, you have a duty to report the suspected violation to your supervisor or the corporate compliance officer. This can be done in person, by telephone, or via email. Reports may be made anonymously. The source of all reports will be maintained confidentially to the extent permitted by the law. New Dermatology Group and health management partners strictly prohibits retaliation against anyone for reporting or inquiring in good faith about what they believe to be a wrongful or unlawful activity, or for participating in an investigation or proceeding related to such activity. New Dermatology Group and health management partners considers such reporting, inquiring, and participating to be protected activities in which all members of the New Dermatology Group and health management partners may freely engage. Procedure for investigating possible violations. Any report or evidence of suspected violations of law, regulations, or applicable standards of conduct, once forwarded to the compliance officer, are fully investigated. The compliance officer will review the report or evidence and determine whether there is any basis to suspect that a violation occurred. Once the investigation is complete, detailed reports of the findings are provided to the Corporate Compliance Committee, payer organization, if applicable, and appropriate governmental agency, if applicable. Auditing policy and procedure. To assure members are effectively adhering to the corporate compliance program, policies, and procedures, the New Dermatology Group and health management partners reserves the right to audit activities of providers, billing and coding, and other billing processes as they relate to business and operations of the New Dermatology Group and health management partners. These audits may also be performed as a result of complaints or concerns reported to the compliance officer. Audits will include a review of compliance with documentation, coding, medical necessity, advance beneficiary notices, and other such matters as may be determined from time to time by the compliance officer or compliance committee. Vendor-sponsored educational grants. It is important to avoid even the appearance of impropriety in any transaction with vendors. As such, an educational grant should never be received when the intent of the grant is to obtain a favorable business outcome. Educational grants from vendors must provide a benefit to New Dermatology Group and health management partners by enhancing the quality of care provided to patients. The employee's supervisor and the compliance officer must approve all vendor grants. It is the policy of the New Dermatology Group and health management partners to use its best efforts to comply with all rules and regulations regarding claims for payment under the Medicare, Medicaid, and other governmental health programs. Claims for payment and cost reports to government health care programs should be submitted according to current reimbursement rules of the government payer. Services must be properly documented, and claims submitted only when appropriate documentation supports the claim. All providers and coding personnel are expected to comply with the official coding guidelines. Clinical staff and reimbursement staff shall use their best efforts to communicate effectively and accurately with each other to assure compliance. In the event it is discovered that a claim has been incorrectly submitted, the fiscal intermediary or carrier shall be promptly advised and overpayment promptly reimbursed. Claims shall be submitted to government health care programs only for services when there is a reason to believe they are medically necessary and are ordered by a physician or other appropriately licensed individual. Providers are expected to obtain an advanced beneficiary notice from Medicare beneficiaries prior to providing services, whenever there is a concern that Medicare may not pay for the service. Antitrust compliance. With respect to activities, negotiations, and interactions with competitors, no employee, director, or agent of the New Dermatology Group and health management partners has authority to enter into any discussion, communication, or agreement that would have the effect of reducing or eliminating competition, controlling prices, allocating markets, or excluding competitors, unless previously approved by legal counsel. This includes not only formal written agreements, but also so-called gentlemen's agreements or understandings. Disposal of records. It is the policy of the New Dermatology Group and health management partners to treat all patient healthcare records confidentially and to comply with the laws governing confidentiality of patient healthcare records when disposing of records. Appropriate disposal of records containing personal health information records must include one of the following: shredding before disposal, erasing personal information before disposal, modification of the record to make personal information unreadable, the use of secure paper disposal bins, or other actions to ensure that no unauthorized person will have access to the personal information contained in the record. Record retention. New Dermatology Group and health management partners have adopted guidelines for retaining necessary records for the appropriate length of time. It is important to consult these guidelines prior to destroying any records. Records retention requirements pertaining to managed care agreements and federal accountable care arrangements are generally 10 years. More information on record retention requirements can be found in the Rules and Regulations, Participation Standards for ACO Programs and Plan Agreements. Response to a search warrant, subpoena, or request for interview. In the event that agents of the federal or state government present you with a search warrant seeking access to the New Dermatology Group and health management partners' books, records, or documents, do not panic. The employee should immediately contact the compliance officer. Employees are not required to speak with agents even if they are served with a subpoena. Employees are encouraged not to speak to agents except to the extent necessary to comply with the search warrant. The New Dermatology Group and Health Management Partners requires all transactions with physicians and other healthcare organizations be reasonable and constructed in good faith to comply with all applicable laws and requirements of state and federal laws. All New Dermatology Group Health Management Partners contracts with physicians must comply with the Stark and anti-kickback rules. The Board of Directors must approve all contracts with physicians or their family members. Compliance starts with you. Every employee can help support our compliance program by following our organization's core values and corporate compliance policies and standards of conduct, by learning laws and regulations that affect their areas, by conducting business in a professional manner, and participating when the department reviews processes and help to identify practices which may be unlawful. When faced with a decision or situation that causes you to question your ethical judgment, ask yourself some of the following questions. Does the action comply with New Dermatology Group Health Management Partners' policies and procedures? Is the action legal? How would it look to your family, friends, our patients, and the general public if it was published on the front page of the newspaper or showed up on the 6 o'clock news? If you know it's wrong and have to ask yourself this list of questions, don't do it.